As I've watched, listened, read, and researched, while the Ebola virus has claimed victim after victim, primarily in West Africa, I have become increasingly concerned over the grave risk healthcare workers face in treating those infected with the fatal disease. With the second nurse in the US of A this week infected with the Ebola virus after treating Liberian Thomas Eric Duncan, who died last week in Dallas, the concern is heading much closer to home. How many more nurses and staff or even non-medical personnel in Dallas will become infected? While healthcare workers daily face risk with a myriad of illnesses and diseases, the confusion, the uncertainty, the untried protocols in dealing with the Ebola virus seem to be upping that risk by a wide margin. In most cases of infectious diseases, there is a defined treatment or even a vaccine. With Ebola virus, though, the disease was discovered over 40 years ago. We are still in the dark. I'm not the only one noticing the unprecedented exposure and infection to those Bartons and Nightingales treating Ebola patients. The World Health Organization noted the outbreak of Ebola virus disease in West Africa is unprecedented in many ways, including the high proportion of doctors, nurses, and other healthcare workers who have been infected. To date, more than 240 healthcare workers have developed the disease in Guinea, Liberia, Nigeria, and Sierra Leone, and more than 120 have died. Texas Health Presbyterian Hospital has become the focal point of the disarray in which our medical authorities appear to be. At times, it is like watching an old film reel of the Keystone Cops. We seem to know so little. Several nurses associations are blaming the lack of training and equipment. Nurses are saying they aren't being told proper ways to cover up and prevent infection. Nurses are complaining that hospitals do not yet have protocols in place in the majority of the nation to treat Ebola patients. Yet I wonder, how much would it really help? Look at the number of healthcare workers in West Africa who are being infected and dying from Ebola. 3 healthcare providers from the U.S. came back from Liberia infected with Ebola. Thankfully, all 3 have recovered and survived. These American aid workers would have been better equipped than their African counterparts. Yet still, these 3 American medical professionals were infected with Ebola. What is the answer? I do not claim to have a solution, but I do know there are those brilliant souls in medicine or other sciences who can develop the proper protocols or design the life-saving uniform. From the cornfield, how can average people feel safe, secure, and trusting the doctors telling us there is little risk and chance of an outbreak in the US of A when healthcare workers can't be better protected from infection?